Hello. Welcome to Little Wins. I'm Tony, and this is my channel, Little Wins. If you've come before, thank you for coming again. If you're brand new, welcome. I'm glad you found us. Today I wanted to talk about doctors. So just to catch up, I have a few videos. I haven't been online long, so it's not hard to go back and catch up videos. But what I have out there, so you can always catch up. But I am here because I am a Parkinson's with cervical dystonia patient. I have been having a lot of depression issues, as well as a lot of issues with just dealing with all of this as it is. So I wanted to share with people how the real life happens with Parkinson's disease as far as me. Now, everyone is different. Everyone has different layers and different things. I have talked about some of the symptoms I had previous, and I wanted to talk about today the process of doctors. It's a hard process. Any of us know, if we have or have had children that have been ill, or we have been ill, or we've had something happen, it can be really, really hard to navigate healthcare. And I have learned a few things in navigating healthcare that I can share with you, and hopefully they'll help. I'll share those along the way. Today I wanted to talk about my first appointment with my doctor after my niece. Now, I told you before, my niece said for me that I needed to see a neurologist because she said I have Parkinson's, because she noticed a tremor, but it wasn't like this tremor at the time. It was much more gentle. So at that time, she when she told me to go, then I made an appointment right away with my general practitioner. Now, my general practitioner is a physician assistant, and I absolutely love her. But the first appointment I ever had with her, I swore I would never go back, because she told me, I had asked a question, and she said, if I have time in this appointment, I will help you with that, but this appointment is scheduled for this amount of time. And I was really confused, and then I kept thinking about it later after I wasn't so upset about it, that she said it for a reason. She had a reason. She wasn't being ugly. And I went back to her, and I ended up loving her. She's great. But anyways, sometimes we don't always mesh with our doctors right away, and they deserve a second chance or a second look, or we need to remember that they've had bad days themselves. So our care providers aren't always bad. They're just human. So sometimes you need to switch. I had to switch my GI doctor, and sometimes you don't. Anyways, I had went to see her, and my kids had went with her, and it was my first visit. And that was the most scary visit of my life, because she gave me, in that visit, she was asking me questions And to answer her questions, I would have to think about things. I would get confused on things. And my kids mentioned the confusion I would have. I told you I filled the ice trays with Downy. Another thing I've done is I did a load of laundry and folded it in the basket and set it in the outdoor trash can. Instead of putting the laundry away, I threw away the clean laundry. So there were some big things that happen and still do, but there's little ones too. Now that's part of Parkinson's is dementia, which I didn't know that was part of Parkinson's at the time. And so on that visit, when she was asking me some questions that they contradicted my answers to, she began talking to them, and almost like I wasn't there. And she asked me first, of course, if she had the right to talk to them, and of course I said yes. She talked to them and asked them so many things about me before examining me and about different behaviors I was exhibiting. And we talked about how exhausted I was and how I couldn't sleep and how my legs were going crazy all the time. And I asked her, is there anything I can take or do to help sleep? So on that day, because she doesn't know why I'm having a tremor, she doesn't want to give me any medication. I even tried to get my shingles vaccination. She wouldn't give me the shingles vaccination because she didn't want to mess with my brain or know if it messed with my brain. And I couldn't get something for sleep or suggestion. The only suggestion she had was melatonin, which I went to that until today. I'm taking 20 milligrams by prescribed. That still isn't working, but we'll talk about that as time moves on. So she did that, and she had some exams and that she did, little ones. And my tremor was light enough to where you can't see it like you can see it now. You could see it, but it's not this prominent. And like she had me hold my hands out, and when I did, my neck activated more, and she told me there's the tremor. She could see the tremor more by that posture in the exam, and she was immediately making a referral to a neurologist. But the scary thing that happened that day was she left the room and she came back with a printout of paperwork so that I could the paperwork she brought in, and she told us that it was a good idea to give medical power of attorney to my kids, one of them or both of them, so that if they needed it, it was ready to go. And I said, why? I mean, they ask you this all the time when you go to the doctor, but this was a scary moment for me to have that done, you know. So we gave that to them, and you know, of course they take me everything. And she got me set up, and she set me up to do a lot of lab work just so she could have stuff done. And she sent me to a neurologist who specializes in Parkinson's disease. So, and she told me the next thing that she knows is that he would do an exam, and for sure he would do a CAT scan. Now, by this point, from the time my niece had told me what was going on and my going to the doctor, I had been looking and seeing stuff from Uncle Google to find out about Parkinson's disease, and I found out that there was no real test for Parkinson's. It's accumulation of symptoms, but they do MRIs to rule out brain tumors, and I didn't have any. Thank God. But that was the first thing that my neurologist did. Now, my neurologist, when I went, I was prepared for a short visit. I was there for probably 2 hours with him. First, his nurse did some assessment, and she did some of those cognitive tests. She did cognitive tests and say 5 words and what is this and what is that. And they said I did okay. I didn't do horrible, but I didn't do what I should be doing. So then the neurologist came in and did a bunch of tests. I'm noticing, I'm sorry, off the subject, I look really red. That is because I am sitting in front of the chicken brooder, and they have a red light on so my chicks can stay warm, and the red light is shining up on me a bit, so that's okay. I'll have a red face. Y'all don't mind. It's my face. I don't have another one, so it can be red right now. We don't care, do we? Anyways, so my doctor came in, and at first I wasn't sure if I was going to like him. But it wasn't something he did wrong. It was the testing. I think it was the testing. I think that came from me. That's why I say we have to give people a chance. You know, it's sometimes what we perceive as somebody else's fault might not be somebody else's fault. I didn't want to be there in the first place, right? I didn't want to be going through this in the first place. So my head, my thought process was not in a way that I wanted to look at him for who he was and how he was trying to help. Instead, I was looking at him as Miss Angry Pants, because I wasn't rude with him, but I wasn't enjoying the process. And we've all seen, I think most of us have seen, what a sobriety test looks like. I watch a lot of true crime and body cam videos and stuff. Don't know why, but I'm obsessed with true crime. And I've seen people taking sobriety tests. And I said, oh no, this doctor's asking me to do like sobriety tests. And I'm still at my small trimmer time at that time. Just a low, controllable trimmer. Or a trimmer that I didn't even know was there. except for sometimes, because I didn't feel it, and I certainly didn't feel it in my sleep. So we go for that, and he having me do stuff, follow his finger with my eyes, don't move your head, but I kept moving my head, and touch my nose, and hold my arms out straight, and this thing that you have to do, and touch your fingers, and do it super fast, and do this when you can do it faster. And so he's having me to do all this different stuff, and fall, and he'll catch me and stuff like that. And he got done with everything, and he said, like, yes, you have a family history of Parkinson's. My grandfather had Parkinson's. I had no idea what Grandpa had. I just knew that his hand shook, his right hand, but I didn't know then that what Parkinson's was, and I really don't know what else my grandpa might have suffered without my knowing what Parkinson's really was, and how it really can affect you. I'm sorry, I'm talking slower tonight. I am extra tired today. I'm so extra tired. Anyway, I'm tired, but I want to get this out there. I want to be able to reach people and hopefully help them in the process. So I done this, and he said, I know you have a family history of Parkinson's, but you ever so have a history of taking this medicine for gastroparesis, Reglan. I took Reglan for quite some time. And he said it can cause tardive dystonia, not dyskinesia, not the one you see on TV talking about the Ingrezza for this thing and everything. And I said, okay. And he said, I was really confused, because I was pretty sure, reading through the things from Uncle Google, that my history was saying yes to Parkinson's. But I have my neurologist telling me, I don't think so. I think it's this. So I have to find out what tardive dystonia is, and it is a dystonia that's caused by some medications that cause neurological disorders in your brain, but it's not the same as dyskinesia. So I said, okay. And he said, I'm going to give you Ingrezza. And we had to fill out some papers, and they're going to get it to the pharmacy and call it. But I didn't understand that. I had to sign something. But I nor my kids understood. And we went to the pharmacy to pick up this Ingrezza. And the pharmacist said, you can't get that here. I've never even seen it before. And I said, how do I get it? I have no idea. And then it was a few days later when my doctor's office called and said, hey, we got approval for your insurance for your Ingrezza. Because I'm also looking, how much is this medication that they have to call and get an approval? This medication costs between $7,000 and $8,000, depending if you're starting the dose or ending the dose. And it's for 1 month with one daily pill. I was in shock. And I was like, okay. And then I get a call from CVS Specialty Pharmacy. And they said, we got your prescription for your order and everything and all of this. And I said, okay. And I had to answer a tremendous amount of questions for them. And I felt like I was in a drug trial, not in a treatment. And I'm not sure why. Maybe the drug is so new, maybe for the cost of it. I don't know how that worked. But they had told me they were out of Illinois. So I said, well, how am I supposed to get this medicine? You know, these are things that doctors, nurses, medical clerks, they all are used to these answers. They know it. It's in their head. That's their daily life. That's their job. If you work at a factory building cars, you know what all parts go in, but you're going to leave out all the little details and just say the highlights if someone asks. And that is how they were doing things, you know, no different than any of us would. But I was confused and I was upset, and I had to roll it back and think about it. Maybe they didn't have time. Now, I didn't roll it back immediately. It took me some little bit to roll it back. I wish I would have thought about it immediately, but I was frustrated with the whole situation and very much into crying every day and thinking, how are people supposed to take this medicine? You know, how are people supposed to pay $8,000 a month for medication? Now, there are lots of programs where you can get medications at low or no cost, and I am happy to help you know how to do that. All you have to do is place it in the comments and ask me, and I will be happy to help you, and I will try to do a video about it one day. Opal came to see us, but there are ways, but it's still hard. So they get this time, and I think in hindsight, the best thing I can tell you in this situation, because you will run across it. You will run across, this is medicine, how do I do this? They'll leave out information, you'll be confused, you won't exactly know. It can be your own confusion in your own brain or for somebody else. The best thing that you can do is advocate for yourself and ask them the questions. Just ask, how am I supposed to get I don't care how stupid you think I am for asking how I'm supposed to get this medication. You know, if I had been thinking clearly, or it was even 4 years ago, 3 years ago, I might have been able to know that automatically. Oh, they must send it in the mail, and just not have to ask. But I had to ask. And it's okay if you have to ask. You have to be able to advocate for yourself if there is an issue, so that you can say, hey, I need X, Y, A, B, C, Z. You need it taken care of. You need to know all the things. You need to try really hard to trust your doctors. This was one where my son and my daughter really kicked in and kept telling me, you know, I start with Uncle Google again. What is cervical dystonia? What is this? What is this? And he doesn't want to do this or that. And my son and daughter said, listen, you're grounded from Google. You cannot look up anything to do with your disease, your symptoms, or the way you feel. You can't. You have to trust the doctor, and you need to trust the process of what you need to do to find the answers. That's what they went to school for. You didn't go to school, and you're not going to learn it from Google. And they were so right, because I was damaging my brain by devastatingly, not damaging my brain. I was devastating my thoughts by dwelling on or trying to figure out all the information for myself and not trust what was going on. That's what I tried to do, is not trust my doctors. So they reminded me to trust my doctors, and it was helpful. It didn't stop the mental anguish of what is happening in my life, but it was helpful. So that is the first visit, and I start taking the Ingrezza, and I seen the doctor again 60 days, I think, 60 days later, to make sure the Ingrezza is working, which it is not working. And by that time, my head is what my daughter calls a full-on bobblehead. I've got a full-on bobblehead situation happening. And my voice tremors and everything. And I'm in physical therapy I think I was twice a week in physical therapy, and I had occupational therapy and everything on top of that. And then all the other doctors in between there too. I had to have different scans, which I'll go over those different scans. And I had to see the urologist because the Parkinson's causes my bladder to spasm all the time. So I had to take medicine to stop that spasm. And the first medicine they gave me broke me out in hives, and I ended up in the emergency room because I had hives. And they say there's allergic reaction, then there's hives with some anaphylaxis, and then there's all the way. I was in the middle. And so I had to switch medicines, obviously, and I was going through those things in between seeing my neurologist, going scans. What else was I doing? Oh, therapies. All the things you can think of, I'm going to them and doing them and trying to make sure that I get all the stuff done that I can get done, trying to make things better, doing my physical therapy at home. I would have doctor's appointments before the fall was even here. I was in the doctor sometimes as many as 4 to 6 appointments a week. And that went on for a couple of months before I saw my neurologist again. Oh, I had the endoscopy in that time period again, and twice, because I had to have it 60 days because the ulcer was so bad. They had to do it 60 days later for the new medicine I was taking, to see if the new medicine and a whole bunch of antibiotics and antimicrobial, whatever it's called, was working. Microbial, I can't think of how, microbial something. Anyways, to make sure all of that was working. And then I go through all of these things in just 60 days time, and I am crying constantly crying. And I get back to the neurologist. My kids take me back in, and my tremor's worse. I feel worse. I'm more exhausted. And in with my neurologist for what I think is going to be 15 minutes or something again, and it is another hour visit where he said, wait, you don't have tardive dystonia. If you had it, the Ingrezza would have worked, but the Ingrezza is not working. So you need to quit taking it. Quit taking it. A bottle arrived yesterday that I start taking in 2 days. It's brand new. It costs $8,000. Somebody is paying for that. I tried to be able to donate it. It's a pharmacy bottle, unopened. It's still sealed. I've tried donating it, tried the doctors. Nobody will take that medicine. So if anybody knows of a place that can take those medicines that are sealed and unopened pharmacy bottles, please let me know so I can donate to not an individual. It has to be an actual place where they actually can prescribe it to you. I can't just give it to somebody randomly, obviously. But anyways, when I was there that day and he examined and went through stuff again, that's when he told me, based on the information that he has from the physical therapist, part of the scans that he has gotten in, the occupational therapist, the blood work, and my lack of improvement with Ingrezza, that he believes I have Parkinson's for sure with cervical dystonia. So that's when this cycle of all of these things keep coming in different diagnosis. I can go and it'll say cervical dystonia. I can go one time, it'll say Parkinson's disease. And he will tell me I have both because the coma's there. And he's going to do another test. If you have Parkinson's, you may or may not know about it. There is a Paris, I believe it's called Paris, don't quote me, but you can Google skin biopsy for Parkinson's disease. So we are setting up, he is setting up skin biopsy for Parkinson's disease, where he will take a skin biopsy and you can see how many proteins are in the skin that are the proteins that inhibit dopamine receptors from working in the brain. Those proteins do. And they do have that way, but it also can confirm multiple sclerosis and other things like that. So that with, in fact, the coma, he can better diagnose. So there's a lot of things we can talk about and learn together on here. But the most important thing we have to learn when we're starting the process is maybe the doctor needs a second chance. Maybe. Maybe it's us who are making the doctor not the best. Maybe it's our perception because of our feelings of being sick and we're not doing the best we can do. And we have to advocate for ourselves. We have to advocate to get what we need done. You know, we have to say, hey, this needs to be done or that needs to be done, and ask those questions, because there is, if you don't ask them, who will? I don't care that they want to talk to my kids to verify stuff. If I don't understand something, I ask. I go ahead and ask till I do understand. And that is good for you as well. Ask your questions for you. Be your own winner. Be your own patient advocate. Be the one to make sure stuff is done. Ask the questions. Do your part. You know, they told me do things, and I have done them to do my part. I do my physical therapy at home. I do things. So that is your little win for today. When you advocate for yourself, when you follow your doctor's instructions and you do your physical therapy at home, or you tweak your diet. Maybe you have a high A1C and you need to tweak your diet and maybe not have that little Debbie Swiss cake roll I want to eat right now. Maybe if you just skip that one and do a few changes, take a little walk, then you're doing things for yourself. That is one thing through my depression that I did do, is every day I was at physical therapy, every scheduled appointment at 7 a.m. doing my physical therapy. And I till now still do my physical therapy and occupational therapy at home. And this yarn is part of that, because I have found that I can clasp, and the little pressures and muscle movings help, and my fingers moving help. So I do crochets to keep my fingers moving. So little wins. Advocate for yourself. Ask all the medical questions you need to. Be accountable to yourself for your own health care by following your doctor's instructions and trusting their process until they show you you can't trust them. And forgiving others that your perception of them is bad, when it's really more you projecting your ill feelings and you're upset over the situation that you're in onto someone else. We can all do better things if we try from there. If you or someone you know suffers from Parkinson's disease, dystonia, any disease, any issue that has changed the course and direction of their life, share my videos with them, and hopefully it's my prayers that they will help someone to feel better, to have positive thinking, and not get in that very, very dark place that I was in. Hopefully it will give them hope that they can change and embrace their new normal. It's not easy, but this is a safe place to try and ask questions. Feel free to leave any comments below. If anybody knows about the Ingrezza or the other medications that I have that are unopened and I cannot take them, let me know. If there is a place, organization that they can be donated to, because I haven't been able to find one myself. Like and share the video, please. Hit the subscribe button, and we will talk again real soon. Thank you and have a good night.